Hey everyone and welcome back to my channel Physiotrendz. This is me Physiotrendz Shah, MPT Ortho and Sports Associate Professor at Vikas College of Physiotherapy. My dear friends, this video I have particularly made for avascular necrosis of hip joint, and this is very important from the physiotherapy point of view. Why? Because physiotherapy is the only conservative management which is meant to be very effective for this condition. So let's begin this video with understanding of what is avascular necrosis and what is avascular necrosis of hip joint. Now we know that avascular necrosis means that vascular supply to the bone is restricted or limited, and because of which bone goes for necrosized or death of the tissues of the bone, and because of that patient starts getting the symptoms. When it happens to the head of the femur, that is considered as avascular necrosis of hip. Now why avascular necrosis of hip is very much common? So for that we have to understand that it can be caused by traumatic or atraumatic conditions. Traumatic, like it can be road traffic accident or direct trauma, or it can be dislocation, or it can be chronic steroid use. Atraumatic can be chronic alcoholism, coagulopathy, or it can be congenital. Now we need to understand that why it occurs to the head of the femur more oftenly in compared to any other parts of the body. So for that we need to understand the blood supply of the head of the femur. So here blood supply of the head of the femur is mainly given by the medial and lateral circumflex branches of the profunda femoris, which is the deepest penetrating branch of the upper thigh. Also apart from this, there is a foveal artery, also known as artery of ligamentum teres. Its contribution is also significant, but more in the pediatric population. So as we all can see here up, this is the anastomosis around the head of the femur, which supplies blood to the femur. Any cut off to the blood vessels over here can cause necrosis in this area. There are mainly 4 stages. Stage 1 is initial stage, which is basically reversible if we can get the blood flow back to the particular area of the bone. Second one is fragmentation, in which body resorbs the necrotic bone and replaces it with the woven bone. So basically here it starts that the death of the tissue starts, and because of that the actual bone is getting replaced by the woven bone. The third stage is reossification. This is in terms of recovery. Once blood supply is revived, we can see reformation of the bone, and the fourth stage is healed or remodeling. Now we know that mainly in elderly population, the stage 3 and stage 4, to get these 2 stages is very much difficult, and that is why we might have to choose other options for the treatment, which can be conservative or surgical. That we are going to see in the next slide, so just be here. And before that, let's see the symptoms of avascular necrosis and how we can identify the symptoms clearly so that we can prevent this condition in the initial stages. So most of the time what we see is patient is asymptomatic in early stages, okay, but patient also will have some pain around the hip bone as well as groin area, and pain typically aggravates by activities such as walking, climbing, and also it reduces when you are resting. So this condition and this situation is slightly different from the other conditions which also causes groin pain or let's say hip pain, right? Because in other conditions, like if it is inguinal hernia, or if it is pain because of the bursitis, or it is because of the tendinitis, in those conditions pain will be present at the rest as well. But here, as the patient rests, pain automatically starts reducing, and as the patient performs activity, pain again aggravates. So that is a typical feature that we will be able to see in the starting stage of the avascular necrosis of the hip joint, and that is where we have to correctly diagnose it. Apart from this, the mainly investigation is done with the help of X-ray, bone scan, or MRI. But MRI is considered as a gold standard tool for diagnosing this condition. And that is the reason that we are going to see this Steinberg staging system, which basically gives stage of the condition on the basis of X-ray and MRI investigation. So stage 0 is nothing but normal X-ray, MRI as well as bone scan. Stage 1 is normal X-ray but abnormal MRI or abnormal bone scan. Stage 2 is cystic and sclerotic changes starts in the femoral head. Stage 3 can be subchondral collapse, or we can see crescent sign, or also known as half moon sign in the head of the femur. Stage 4 is head of the femur is completely collapsed. Stage 5 is joint space narrowing, and stage 6 is advanced degeneration. So my dear friends, we need to make sure that whenever you are investigating for this condition, we have to identify at least by the stage 2 or stage 3. Then only we can preserve the joint normally. Otherwise, there is only one choice, which is surgical recorrection of this particular bone. So talking about the surgical correction, let's first talk about the treatment, what can be the conservative management, and then we will talk about the surgical management. So always the treatment depends on the age of the patient, level of pain or discomfort, location and extent of the necrosis, and comorbidities. Comorbidities here can be diabetes, hypertension of the patient, or any other septic condition which is present around that particular area. In such cases, the treatment of this condition conservatively becomes very much difficult. Another thing in treatment, what we can do is restricted weight bearing, discontinuation of steroid therapy or vasodilators. Now my dear friends, this is one of the biggest mistake that sometimes happens because we are not able to correctly diagnose this condition. Sometimes patient gives symptoms like they have vague pain around the back as well as hip or as well as around the groin, and we think that this condition is related to sciatica or it is because of nerve root compression or SI joint compression, and then we start treating in that way. Then it might cause more problems for the patient because you have not diagnosed this condition properly. If you want to know more about how to diagnose sciatica or back pain, you can check out this links, and from where you will be able to understand more about the diagnosing of those conditions. Alright, now let's get back to the treatment part of the avascular necrosis. We can also give physiotherapy. As I told you, this is a very much important part of the treatment in the avascular necrosis of hip. Here we can give shock wave therapy for stimulating the bone growth, but remember, this shock wave is useful only if it is given in stage 1 or stage 2. Later on, if you are giving it, you might also damage the bone, so it is not advisable to give after stage 2 condition. Also, we can give aqua therapy, which is very much beneficial up to stage 3. We can give range of motion exercises to maintain range of motion, as well as we have to give limited close kinematic chain activities and not more close kinematic, because again we know that bone is going for the necrosis. If you are providing more stress on the bone, it might go for the pathological fracture also. Apart from this, the only option, if it is going above stage 3, stage 4, then we have surgical option, surgical treatment. In that we have two options. If you want to go for joint preservation, you go for bone grafting, but chances of getting successful bone grafting are also limited. So that is why the only option which is left is joint arthroplasty. So we have to go for joint replacement, and then only patient can be much better in their activities. So I really hope guys that you have gained some knowledge about avascular necrosis of the hip, and as well as how to identify it, how to investigate this condition, what can be the symptom of the condition, and how physiotherapy can be beneficial treating this condition. Apart from this, if you have any other doubts, do let me know in the comment section.